So angle closure glaucoma is going to be a presentation of headache, painful vision loss. And that's the key here. Sometimes the eye appears red, halos around objects, nausea, vomiting, photophobia. It seems like a migraine, except it's sometimes unilateral, usually frontal, usually retroorbital to some degree. And it's going to be that classic, as Iltifat said, bright light to darkness transition, classically walk-in movie theater or dark to light room, whatever. And it causes the pupil to dilate, and that pushes the iris against essentially the part of the eye, getting the details, but part of the eye that's going to close off that area, and then they're going to build up pressure, boom, done. So what you're going to have on the exam, I love this quote here. It says, a steamy cornea. It's steamy looking. It's cloudy and hazy due to swelling. And the slit lamp, hey, let's say you're listening to this and you're like, whoa, I haven't done a slit lamp in forever or ever in my career. That's fine. Just do intraocular pressure measurement, and that's going to be the diagnosis. And it's going to be high, like 40 to 70 high. Normal range is 10 to 21. So anything less than 20 is considered a normal IOP. Ophthalmologist is going to have to come in to do some laser stuff. It's going to be great, going to be complex. That's why they get paid a lot. And they may do that in the morning, but your job in the evening is to watch that patient. So this is a patient that should not go home. This patient's being admitted to the hospital or they go to surgery. And so what you're going to do in the meantime is give a bunch of meds. One, treat their pain and nausea. The more pain and nausea they have, the higher the pressure in that eye. So lower that with pain and nausea meds. The second is going to be, of course, your anti-glaucoma agent. So timolol is the cornerstone here. It's intraocular. It has to be frequent dosing. It is the cornerstone therapy. If that's the only med you give, that is the best med to give. Other meds would be acetazolamide, which is IV. That's some, sideline meds you can give. Of course, if you're in the community and you don't have an ophthalmologist, of course they're being transferred to a center with ophthalmology. If you're at a center with ophthalmology, you're talking to them and they say, hey, I'll get to it in the morning, you're probably going to have to admit that patient because they're just not going to be able to go home with these meds and they're not going to be able to measure the pressure themselves. So they're staying in the hospital. And that's it.